Assemblyman Rodriguez, and prior to that, Assemblyman Scher had talked about hospitals that have either closed or on the cusp of closing because they're in financial distress and so on and so forth. Heights University Hospital in FY26 was advanced $950,000 of charity care money. In your OLS responses, you refer to CareWell Health Medical Center as being on a, I think it was a, is it ETR, EDR, what, some watch list, right? For lack of a better term?
Yeah, we have a financial monitor there.
Yes. So in FY26, they got $289,000 advanced from charity care. In FY27's proposed budget, they're proposed to get $637,000 in charity care. Given the fact that Heights got advanced $950 in charity care and they ultimately closed, what safeguards are you putting in place within the department to make sure that we're not advancing charity care monies to hospitals that are then closing? I understand it's a balance, keeping it open versus closing it, but like, we've all read stories about what happened with the guys, the group that ran the 3 hospitals in Hudson, right? Christ Hospital and those, right? CarePoint, thank you. I always get them confused with somebody else, and I never want to mention that, but yeah. So, like, what are we doing to manage that and balance that so that these folks aren't, I'm not saying they're all nefarious actors, but so that they're not pulling our money out, and then other hospitals can't get money to care for patients as you have to shuffle them around?
So, Assemblyman, thank you for the question. As you know, as you're saying, charity care is definitely important for our healthcare systems and hospitals. It is an important safety net support for them, and there are tools in our toolbox for trying to, again, avoid situations where charity care is not being used appropriately. And my commitment is to continue to follow the law of the state and as governed by the legislature, to do so to make sure we're leveraging those tools for enforcement.
Yeah, but that didn't answer my question. Let's talk about CareWell Health. They're on your watch list. They got $289,000 advanced in charity care. They're proposed to get a total of $637,000. What are you guys doing to make sure that they don't come to you looking for an advance as you have a monitor in place and then they shut down, as is what happened with Heights?
Sure. Sorry, I don't think I fully understood your question, so I apologize if I didn't answer it. But let me just be clear that as the legislation dictates, we do advance charity care to all hospitals in the middle of the year. So they get their first advance based on their projected utilization. And then we shore up the hospitals at the end of the year. So every hospital receives an advance. What you are speaking to are those who request that second half to be advanced because they're having financial distress or they need it for cash flow. So in those instances, again, we are, the charity care program has very clear rules that govern it. And so we do continue to ensure that we are adhering to those rules as it relates to governing them, and it's sort of separate from the financial monitor. So the financial monitor, of course, is watching the in and outflow of cash and receipts at the facility, which of course charity care is a part of that, but sure, it is a sort of separate situation. So, and because it is a retrospective payment, it's for services that have been already delivered to patients who don't have insurance. So, in general, I would say we don't typically have concerns, and as I mentioned already, we do have some enforcement levers that are built into it to allow us to, if we run into situations where it's not, the hospitals aren't holding up their end of the deal, that we can take action.
Okay. Next item up, your overall department budget is down about $112 million on the state dollar side, not federal or anything else, right? Your state budgeted staffing positions are going up 490. May I ask why?
So I don't have that in front of me, but I will say to you, our FTEs and the department, the report in the OLS report is not the full picture. of the FTE situation in the health department, and our FTEs are not increasing by 400 year over year. I think that's just might be a interpretation issue there. But also what you see in terms of our funded and filled positions does not include individuals who are out on medical leave or family leave, or individuals who are in a temporary status. So there's some nuance there, and I'm happy to provide more detail to it to where I have visibility to it back through the chair.
And look, and I get it, right? Sometimes you allocate positions that you don't fill, so you can do it. I understand all that. The additional question on that I have is, how much are you allocating for staff salaries? What is the dollar amount?
I'm happy to get our salary budget back to you through the chair, unless Eric has it, the total amount handy. I'll get it back to you through the chair. It is.
I don't have the exact salary, so we'll get back to you.
Part of the complexity, Assemblyman, with our budget is the majority of our workforce is the psychiatric hospitals.
I understand.
Their budget is within and slightly separate. You all know the history of how it's moved around, and so and that's where we also have significant staffing challenges. But it is a 24/7 operation, and so we do have to leverage both overtime and temporary staff to be able to keep up. The rest of DOH is also largely it's a mix of federal and state positions, and so it is not as simple, for lack of a better word. But again, I'm happy to provide a more detailed breakdown for you.
And then, if you can, also, how much you spent in FY25 and 26?
Sure, absolutely.
Okay, so next item up that I have for you is your budget page D173, the New Jersey Immunization Information Systems Program. You are increasing it by $1.866 million, correct?
That's correct.
And the governor is recommending cutting on budget page D174, New Jersey Center for Tourette Syndrome and Associated Disorders, by $455,000. Is there a particular reason why you're cutting that program by $455,000?
Assemblyman, as I said in my opening comments, our state is facing a significant structural deficit in our budget, as you know. And in preparing the FY27 budget, some difficult decisions had to be made about ensuring we protect, as I said in my earlier remarks, access to the core infrastructure and health, public health, as well as in investments in the systems that have the broadest reach across the state. And so, I won't speak. It's not. No particular cut is a reflection of policy necessarily. It's a reflection of the tough fiscal environment that we're in.
So is the tough fiscal environment the same reason why the ALS Association is being cut by $325,000?
Again, sir, and the reductions in our budget reflect reductions in the one-time non-competitive grants that I think you're speaking to. The ALS Association, which is page D175, for any of your folks listening at home, it has gone from $1.5 million in FY24 to $498 in FY25, and then last year in FY26 it was $325, and this year it is $0. So it is not a last-minute, last year, June 29th legislative add-on. This is a line item that has been consistently in the budget. Assemblyman Barlas, I'm happy to get back to you to the chair on that specific.
No, right. But I'm saying you had mentioned that the Tourette syndrome cut was because of the difficult financial situation that the state is in. I'm assuming that that is the same rationale behind this cut?
Just to be clear, though it was funded multiple years, it was a one-time non-competitive grant. And so again, as I said, we are facing some tough budget decisions. And so essentially what's proposed here is the governor's proposed budget, and I look forward to the legislature working forward now to determine where we land as a state for next fiscal year.
So, okay, so here's, here's the bottom line. You're increasing the New Jersey Immunization Information Systems funding by increasing it 1.866 million. The next item is the state vaccine program is going up 2 million. However, both those programs are adding in the New Jersey immunization system is taking, of that 1.8 million, they're taking 424,000 for 4 positions. The state vaccine program is taking 383 for 4 positions. So that's a total of a little over $800,000, and you're cutting 2 programs that are also $800,000. So what I'm having a hard time reconciling is we have a tough budget. We've heard that from everyone that has sat in your chair before you, but you're also increasing allotments for payroll.
Sure.
While cutting programs. You know, we had the young lady here, the chair was here, the young lady from the, for the ALS Association, who's come in every year, and at one point she started out actually talking, and this year she had her computer projecting whatever it is that she was attempting to say that day. So, I get it. We all get it. It's a bad year, and there's cuts out there in the ether that have nothing to do with New Jersey that we're not going to talk about. But how do you say you're cutting 325 for ALS, but you're taking 383 for 4 new positions? Like, I can't, somebody's got to help us justify that.
Assemblyman, I will tell you that the investments in our state's immunization registry are essential to core public health operations. The
I'm not
immunization
questioning that.
registry
Commissioner,
system.
I'm not questioning that. I want you to understand, this is not a vaccine, anti-vaccine conversation. It's not. What I'm saying is, you're taking 1.8, of that, 425 is going for payroll, yet you're cutting Tourette's by 455.
If you will let me finish, I'll explain.
Yes.
The payroll aspect of this are essential staff to ensure that system functions. And again, our decision-making about what's proposed really is about what's essential. I said in my opening statement that this is a reflection of what will protect core public health function, and we need the registry to function so that families can access their immunization records easily, and so that folks will know where they are with their vaccinations that are recommended for those individuals, and this is so that the systems are functional. It is absolutely essential. Similarly, on the vaccine program, it's also to ensure that those vaccines can get out the door to communities, and our requests are what's proposed here in the governor's budget is what we would deem to be essential.
Okay, so the follow-up, and you don't have to answer it today, you can get back to us through the chair. In the New Jersey Immunization Information Systems, this is a program that has been up and running since at least FY24, right? 500,000, 500,000 in 25, 2.5 million last year, and 4.366 in this proposed budget. So clearly somebody within your agency somewhere has been administering this program.
Yeah.
So I'm just asking for, not now, through the chair, this 424, if you can please explain to us how this additional 400,000 is going to help you administer a program that has already been stood up and is functioning.
Let me clarify too, some of the staffing resources to make those initiatives function were supported with federal dollars that are no longer available to us. Those federal dollars that I mentioned in my opening remarks that we as a department will no longer have access to as a part of the COVID-19 funding that will be ending later this year. So again, this is not necessarily new capacity. It's trying to maintain the systems that we've been able to establish.
Great. So if you could just explain that to us in writing, that'd be very helpful.
Absolutely, no problem.
Thank you very much. Thank
Sure.
you, Madam Chair.